Namaste. I'm Dr. Swamynadh. I'm a surgical oncologist working at Yashoda High Tech City. Uh, I wish to create awareness regarding what causes cancer and how do you and when do you approach a doctor for cancer screening. Now, what are the causes for cancer? The most common thing that causes cancer are a poor lifestyle and stress. Okay, all of us are subject to stress. So to manage stress in the form of meditation, yoga, and engaging in physical activities. These are the best modalities by which you can de-stress yourself, become physically active. As far as diet is concerned, habits like smoking, alcohol, pan, zarda, gutka are all implicated and known cancers of cancer. Now, the simplest way to avoid unhealthy food is to have a balanced diet. Kindly make sure that 1/3 of your meal, every meal contains vegetables or fruits. And how and when to approach a doctor regarding the diagnosis of cancer. The two most cancers that are very common among our population are the breast cancer and the cervical cancer. Any lump in the breast, okay, which is there for more than a month, painless, slowly growing in size, needs to be examined by the specialist. And all ladies above the age of 40 needs to be screened every year with a mammogram. And for cervical cancer, any abnormal bleeding or bleeding between the cycles or pain at the time of meeting with your life partner, excessive white discharge are all symptoms that need a gynecologist consultation. And from the age of 35, an annual pap smear till the gynecologist says it is not necessary is a must. And one important aspect that I need to talk about is how to prevent cervical cancers. With advancements in technology and science, now we have developed a vaccine that gives you a 90% prevention rates against cervical cancers. Any female or male child above the age of 9 and before the age of 18 or before their first sexual encounter should ideally be vaccinated twice. That is day 1 followed by within 6 months. The second dose should be within 6 months. The chances of reducing development of cervical cancer go down by 90%. And for other ladies, okay, who are already married or who have children, can also take. It is not as effective as for a child, but it still offers some protection against cervical cancers. Again, the dosage is the same. You take one on the first day of this thing, and the second dose within 6 months of the first dose. Another important thing that I would bring to your notice is prevention of environmental pollution. Polluting your air, the soil, and the water that you consume and not protecting them will impact your overall health and can form certain risk factors that increases your chances of lung cancers or skin cancers. More so when you are burning stubble, plastic, the chances of these chemicals being released into the air and probably sensitizing your skin, or when you breathe them, sensitizing your lung to not just cancerous but other significant health hazards is proven to a certain extent. So please avoid discarding plastics irresponsibly. Okay, segregate your plastics and hand them over to the agencies that would take care of them the right way.